So there are a number of different types of lenses available for people who opt for cataract surgery. The vast majority of patients would opt for a monofocal lens. That means that we decide together whether you wanted to have distance vision or reading vision. And the lens that we put inside your eye will have excellent contrast sensitivity and excellent clarity to give you vision at that particular place. So if you'd opt for distance vision, it would effectively be everything from the end of your arm to infinity should be in focus, assuming that the astigmatism has been corrected, which again may require a different type of lens, but we'll get onto that in a little bit. If you opted for reading vision, then depending on where you'd like to read, so if that's at 30 centimeters or at 50 centimeters, then you would be able to see well there, but you then need distance glasses. So you wouldn't easily see in the distance if you'd opted to have reading vision with a monofocal lens. There are other types of lenses available as well. So there are things called enhanced depth of field lenses. They'll give you some flexibility of that vision. So rather than having a hard cutoff for either reading or for distance, it gives you a bit more of a visual blur in those two different areas. So it's not perfect reading vision and perfect distance vision, but it gives you more than just a monofocal. But what you get in terms of enhanced depth of field, you perhaps lose a little bit of in terms of contrast sensitivity. And so nothing is 100% for free. So either you go for perfect crystal distance vision or perfect crystal near vision, or you get a bit more flexibility so you can be without glasses a bit more of the time, but perhaps the clarity of the vision won't be quite as sharp. The next thing that you could do is have a multifocal lens, and a multifocal lens is designed to give you reading near, intermediate, and far. And so that really gives you glasses independence, particularly again if we correct for the astigmatism, which we can talk about in a little while. The disadvantage of multifocal lenses is that you tend to get halos around lights. The way the lenses work is that they're made up of concentric circles. And so when you look at a sharp light source, you tend to get rings of light around those light sources. And in some people that bothers them, but most people get used to it and they stop seeing it after a period of time. The other type of lens that we can implant is something called a toric lens. And all of the lenses that I've talked to up till now come in toric style, which means that you effectively correct the astigmatism as well as how long or short-sighted you are. And so again, if you're really aiming for spectacle independence, then you should opt for a toric lens, because there's no point in correcting your long or short-sightedness and then needing to wear glasses to correct your astigmatism. So when deciding to have cataract surgery, we would have a discussion about what your hopes and dreams are for the type of vision that you'd want, and also what's realistic given your eye health. So some people would be capable of perfect vision, both of distance and for near, regardless of their astigmatism. And other people may have problems with their eyes, which means that the quality of vision you get at the end of cataract surgery may not be as perfect as you might want it to be. And it's really important to identify those factors in advance of surgery so that you're not disappointed afterwards, and so that we've made the correct lens decision together. So you can't really test the lens before we put it in. It's a good question though. There are some things that you can do beforehand. So there's a type of vision called monovision, and that's when one eye is set for distance and one eye is set for near. And that configuration effectively means that some people can manage well without glasses using monofocal lenses. So those are the lenses that see at specific set distances. You'd want to try that before you had the lens implanted inside your eye, because some people love it and some people, it doesn't suit them. And so the way you would trial that is by having a contact lens made up, and that would effectively give you distance vision in one eye and reading vision in the other eye. And then you'd walk around for a while and test that and see how that feels to you. So the main risks associated with cataract surgery are a risk of infection and a risk of retinal detachment. The risk of infection and retinal detachments around 1 in 1,000. So 999 people have an excellent outcome, but 1 in 1,000 people may get a retinal detachment or an infection, which means that they have bad vision after surgery. 1 in 100 people will need more than one operation, but ultimately end up with a good visual outcome. And 1 in 10 people will need the lens polishing 6 to 9 months after the operation with a laser which takes 5 minutes in clinic and is not a surgical procedure. It is possible that if you have a multifocal lens implanted and the halos around the light sources bother you so much that you want to have the lens explanted, that you need another operation to remove that lens and implant another lens. And that can be a difficult procedure, because if you wait until you get used to the lens, then the lens becomes quite embedded inside the eye. And so we tend to avoid doing that wherever possible. But that is a potential risk of having a multifocal lens. So that's a really good question. It is possible to take a lens out of an eye once it's been implanted and put a new lens in its place, but it's definitely not something you should choose to have or should aim to do, because that procedure itself can be quite complicated. And often while trying to take out an old lens, it's so embedded inside the eye that the architecture of the eye, the place where you put your new lens, won't sit nicely. And so you should really work quite hard before surgery to make sure that you have the right lens going inside the eye. However, sometimes lenses need to come out for a variety of reasons. Toric lenses might rotate, and so your astigmatism might be wrong. Multifocal lenses that you have implanted may not suit you in terms of the halos around lights, or very rarely some people have a very low-grade chronic infection inside the eye, which means that the lens needs to come out. So it is possible, but it's definitely not recommended. If, let's say, you've made the choice to remain short-sighted, and so we put lenses in your eye that mean that you can have reading vision, but actually you've decided a year down the line that you'd rather have distance vision, well, firstly, you can wear glasses and that would correct it. Secondly, you could wear contact lenses and that would correct it. But if neither of those options appeal to you, then it would be possible to have laser eye surgery, which would not touch the lenses themselves, but would change the shape of your cornea to give you that distance vision back. So there are things that we can do, but really I put a lot of emphasis on choosing the right lens at the start.